Hello everyone. Most of you would be concerned about the current COVID situation in India. It surely is a case of concern. We are seeing the cases explode almost every day. We are in the middle of a second wave. Our cases are at an all-time high. Virologists are saying there is some new infectious variant which is the reason for this sudden surge in cases. If you look at this chart, this data about the total current cases of COVID since we started about a year ago, since COVID started in India about a year ago, you would see three very interesting points. The first point is you would see that the peak of the first wave, we had hit about 100,000 cases a day. And right now, we are about 3.5 lakh cases, 350,000 cases a day. And yet, we don't seem to have hit the peak. So our peak in the second wave is almost 3 times or 3.5 times our maximum that we got to in the first wave. The second thing you will notice in the graph is that it took us almost 6 months from almost 0 cases to hit close to 100,000 cases a day. And now, very rapidly, from about 10,000 cases to about 350,000 cases, we have reached in less than 6 weeks. So extremely steep growth of the curve, which is why you're seeing a huge challenge at the hospitals and all support systems. The third thing you would notice that in our first wave, we had hit about 100,000 and then the curve began to come down. But as you can see in this curve, the curve still seems to be going up and we're not very sure where would the peak be before it starts coming down. Now looking at this data, some things become obvious. The first thing is clearly the situation is serious, and hence, as people who understand what's happening, the simple thing I would suggest to everybody is to take precautions. Whatever precautions we've had earlier, we just need to do them. And we all know that the virus comes because we meet new people, it travels through the air and we get it from other people. So simple things. Stay away from crowds, stay away from meeting people, and if you have to meet people, make sure that you wear a mask and even the other person wears a mask. And now doctors are saying that it's not enough to wear a simple mask or a cloth mask. Try to wear a double mask, a surgical mask inside and a cloth mask above it. This will reduce the probability of getting the disease or the virus significantly. The third thing that's very interesting is since the virus is airborne, a lot of people are now saying that have good ventilation at your homes or at your offices or wherever you're going. Ensure there's a lot of air circulation. That also reduces the chances of the virus coming significantly. Another very interesting piece of information that we are getting from whatever data doctors are saying is while this variant seems to be a lot more infectious, it's not any more significantly fatal than the earlier virus. The percentages of severe hospitalization and death are quite similar to the earlier one. However, because the number of cases are large, we are seeing a large number of deaths, and surely because the hospital systems are struggling to support, one would see a lot more preventable deaths. So clearly, we do have a serious problem. And what should we do now? So one is obviously protect ourselves. Now second, what happens if we get symptoms? There's a good chance that with the current widespread of the virus, one of us would get a symptom of COVID. And there are multiple symptoms that you can see, right from body ache to headache, to diarrhea, to fever, to loss of smell, loss of taste, a whole lot of symptoms. The first rule of any pandemic is if you have symptoms, assume you have COVID. Nowadays, most tests take time and it may take 2 days, 3 days because the testing infrastructure is also highly stretched. So start your treatment assuming that you have COVID. And the good news is more than 95% of all COVID patients do not need to get to a hospital. 95% of COVID people will get cured at home. However, you need to have a doctor who can give you good advice on how to manage your symptoms to ensure that you are well getting cured or in a systematic manner. And using a simple oximeter and a thermometer, doctors will give you excellent advice how to track yourself with simple medication, 95% of people are going to get better and come out of the COVID infection. Now that we have spoken something about how to handle ourselves and how to handle in case we do get the infection, I want to spend a little time on what has been the learnings from what's happened in other countries. If you take a very good example of a country that all of us know, UK, United Kingdom, and if you look at the data for UK or how COVID has spread there, very interestingly, you would see that just around 3.5 months ago, maybe a little over 3 months ago, around middle of January, COVID was hitting a peak in United Kingdom and they were having close to 60,000 cases every day. And UK is a small country with just about 67 million people, unlike India with about 1,300 million people. And you can imagine 67 million and 60,000 cases a day in a very developed country with good infrastructure was a huge challenge for them. So what we are seeing is nothing surprising. Every country has gone through a second wave. But what happened subsequently? Subsequently, you could see in UK, they managed to vaccinate very rapidly. They did an excellent job of vaccinating their people rapidly. And within a period of about 3 months, close to 50% of all adults in UK got vaccinated. And if you look at the graph post-January, you would see a dramatic decline in the number of COVID cases. And right now, it's less than about 1,000 cases a day, with almost 50% of adults getting vaccinated. And it's great news for all of us in India. If you look at the death cases chart, even that shows a dramatic decline. And around the middle of January, UK was struggling with almost over 1,200 to 1,500 deaths every day. You can imagine a small country like UK having that kind of number of deaths must have been a huge challenge, much more even than what we are seeing in India today. And yet, soon after vaccination, you could see a dramatic drop in deaths. And as of today, they've got less than 20 deaths a day in just about 3 months. Almost the same history or the same pattern has happened in Israel also. Another country which managed to vaccinate a significant proportion of its adults from January when they also were struggling with the second wave. And within 3 months, by early April or mid-April, they managed to control the pandemic quite well. And right now, they're also open for schools and open for even removing the mask mandate in public. So what does this tell us? Very simple. We need to just stay safe. I would say be careful, take all precautions for the next few weeks till this wave subsides. And in the meanwhile, we all need to get vaccinated. Second, not only get vaccinated, encourage the people around us to get vaccinated. Because it's not enough if a few of us are vaccinated. It's only when a large portion of our country gets vaccinated, we are going to see a significant control on this pandemic. And that's really the long-term solution for us to come out of this problem. There are a lot of misconceptions regarding vaccination, and I want to just touch on 2 or 3 of them. The first misconception is vaccinations are not safe. In addition to the fact that all the vaccinations have gone through large-scale trials, the most powerful data in front of us is that more than 300 to 400 million people across the world have already taken the COVID vaccination. India alone, more than 120 million, which means close to 1,200 lakh people have taken the vaccinations. And largely we are seeing hardly any case of concern across the world and across India also. So clearly vaccinations are safe. And the second misconception is vaccinations do not prevent COVID. And that's true. Vaccinations cannot stop you from getting COVID. It only reduces the probability of getting COVID. But that's not the real reason why we should get vaccinated. All the data that we are seeing shows one very powerful thing. Both Covishield and Covaxin have great potential in reducing dramatically severe hospitalization and death. And we can see even during this pandemic, all the doctors and nurses who got 2 doses of Covaxin or Covishield in the first 2 months of Jan and Feb were largely protected against the ferocious second wave, unlike the rest of us who didn't manage to get 2 doses of the vaccine. So clearly, vaccinations are safe, vaccinations work in preventing severe hospitalization and death. And that's why all of you should take the vaccine. The government has allowed vaccination 1st of May for all above the age of 18. So I would strongly recommend each one of us to get vaccinated. Surely there will be some challenges in supply in the first few weeks, but I do hope that will get sorted out as we get more and more vaccines into the market. And once we are able to get the vaccination done for a significant portion of our population, you will see this pandemic well under control. So my only parting advice or my conclusion to all of you is stay safe, take all precautions. In case you have symptoms, you know how to take care of yourself at home. And most importantly, get vaccinated and get your people around you, your friends, your family also vaccinated. And this whole process may take us about 3 months, maybe 4 months, maybe even 5 months. Until then, stay safe. In case you have symptoms, you know what to do. Help people around you as much as you can. Get vaccinated. Stay patient. Things will get better in the next 4 to 5 months. Stay positive and all the very best. Jai Hind.